I realize this sounds like a crazy topic, preparing a checklist for the last stage of life. But as a nurse, I used checklists all the time in my job. It's one of the best ways to make sure you don't leave out something important. My name is Marie McWhite, and I'll be your moderator today. With me is Kem Ellis. If you've been reading our newsletter, you'll know that Kem is the volunteer coordinator for Arizona End of Life Options. And if you sign up to volunteer with us, you'll get to know Kem on the phone as he helps you identify where you might fit into our organization. Welcome, Kem.
Thank you. I'm happy to be here.
Also with us today are two of our doctors who have agreed to answer some questions about how to go about preparing ourselves and our families for our last stage of life. Dr. Dwight Moore is a psychologist and also the chair of the Arizona End of Life Options campaign. For the last 8 years, during the months he is in Washington State, Dwight volunteers for End of Life Washington, helping people navigate the requirements of their medical aid and dying law, and he has attended over 50 deaths of people utilizing that law. Welcome, Dr. Moore.
Thank you. It's a pleasure to be here.
Also here today is Dr. Tom Fitch. Dr. Fitch has been a cancer care doctor for 32 years, and over the latter part of his career has been very involved in palliative and hospice care with the Mayo Clinic. Welcome, Dr. Fitch.
Thank you very much. It really is an honor to be here.
Great. Let's get started. Kem, you have been talking to lots of our supporters about end-of-life issues. And you tell me that you have identified some of the most common areas where people seem to be unprepared for their last chapter. Would you like to get started with these?
Since none of us know how the last chapter is going to unfold, it makes sense to have our affairs in order before that time is upon us. I think the most obvious place to begin that process is with our family members, by talking to them about how we feel philosophically about death and dying. Dr. Moore, what are some of the topics you suggest we talk about with our family members, and how do we go about having those conversations?
It's clear that people will want to communicate with their families about this last chapter. My basic advice as a psychologist is to start those conversations early and expect to have them over time. It's not something that you'll be able to sit down and have once and everything will be tied up. So expect that you'll have a conversation 1 month, and then maybe somebody will find out more information about the will or the advance directive. Then you'll have another follow-up conversation based on that. Another month later, one of the children will have a question that they forgot to ask or didn't know that they wanted to know about. So then you'll have another conversation. That's quite normal. And obviously having these conversations when you have time to have them rather than rushing off to the store or somewhere else, where you can actually sit and be quiet and feel like you can listen to one another is a basic idea. The way to start it, I would say, as a parent, if you're writing your will, for example, or advance directive, is to use that as a reason to inform your kids and share that with them. Share your thinking about it, show them the documents if you actually have them. And you can start with some basic kind of statements like Ted and I have been talking about our wills, and we've been talking about the end stage of life. As you realize, we've had a recent diagnosis. I've had a recent diagnosis of cancer, and so we want to share with you our thinking about that. Is this a good time to talk? Just a kind of a casual, relaxed opening like that would be helpful. It's possible that you run into resistance during these conversations. Resistance may be if the child asks the parent about their plans and the parent doesn't want to talk about it. Resistance may come because the child just gets uncomfortable and feels the loss of their parents' upcoming loss and doesn't want to talk about it. These are times where slowing down the pace of conversation, being emotional and using emotional words. Sounds like you're feeling a little scared about this. I have some trepidation going into it myself. It's an uncomfortable conversation for us to have. I recognize that. Those are examples of using emotional words in the conversation. That allows people to go to an emotional place about this, rather than to stay in your head about diagnosis and treatment options and sort of statistical probabilities. Also share facts with your kids. Tell them that you have a will, where the will is. You have an advance directive, where that is, who the power of attorney is. They are likely to know that person, so that if they feel like they want to talk to that power of attorney, they can do that. Who the primary physician is, hospital of choice here in Arizona, where the orange form is. Tom will talk more about the orange form in a minute. So share facts with those kids.
Thank you for that information, Dr. Moore. On another note, Dr. Fitch, I've heard a lot of conversations about advance directives and this orange form that we have here in Arizona. For people who don't know exactly what those are or what they should address, what are some main points that would be good to know?
So to follow up on what Dwight has just discussed, as we plan for that last chapter in our lives, there is a process in medicine that we call advanced care planning. It's a process where we complete specific documents, some of which Dwight mentioned. They're known as advanced directives. Advanced directives in general tell our doctors and our family about the level of medical care we would want, and perhaps medical care we would not want, if we're faced in a situation of advancing illness and we're not able to speak for ourselves. And unfortunately, that can happen with serious illness. So advanced directives are important things for us to complete, and especially important for all of us to complete, but especially important as we grow older and if we're faced with a serious life-limiting illness. I would encourage everybody to fill these out. So what are they? Advanced directives include several documents. One is a living will. A living will is where you write down and you're telling everyone the kind of care that you would like, and again, perhaps some care that you would not want. Some people don't want to be put on advanced life support, for example, and you can outline that in your living will. There is another document called the medical power of attorney. Dwight mentioned this. You designate someone to speak for you. Again, you're faced with a situation where you're no longer able to communicate your wishes, so you've designated somebody to speak for you. Obviously, you would have wanted first of all, probably somebody you know well. Often it's a family member, doesn't have to be a family member, but what is certain that you need to do is you sit down with them and go over your advanced directive, your living will, and obviously ask them if they would be willing to be your medical power of attorney and what that entails for them, and that you've talked to them about your wishes in terms of the medical care you would want. Dwight also mentioned a form called the Orange Form. The title for that form is called the Pre-Hospital Medical Directive. In Arizona, it's known as the Orange Form. It can be called different things in different states, but in Arizona, it's known as the Orange Form. And that's simply because it must be on orange paper. I tell my patients that if they make a copy of the Orange Form, have one in their home, keep one in your purse or in your car, you have to copy it onto orange paper. So those are the three documents: a living will, a medical power of attorney, and a pre-hospital medical directive or Orange Form in Arizona. I've always told my patients to think not so much of these as advanced directives, but think of them as current directives. It's very hard for any of us to think about our illness, what it might be like in a year from now or 6 months from now, and to think about what our wishes will be at that point. So it's easier to think about how you want to be cared for now. You know how well you're doing, or if you have an illness, or if you're healthy. Fill out these forms with the thought of how you'd want to be cared for tomorrow if something were to happen. That's an easier thing to do. It also, I think, points out that you should, if once you complete your advanced directives, you, as you're being cared for, and through the years, you should constantly review your advanced directives. And if you're faced with an advancing illness, often your thoughts become more certain about how you want to be cared for. But the point is that you'll want to change those over time. You may want to change your medical power of attorney. You certainly might want to change how you want to be cared for, and that should be done. Lastly, it's important for people to realize that advanced directives are only important if you lose the ability to communicate. If you're awake, alert, can communicate your own wishes, the advanced directives really become irrelevant. You're always personally in charge. So you can change your mind at any time. And it doesn't matter what you've put on the documents, again, if you're awake and alert and able to convey your own wishes. Again, the advanced directives are important if you lose that ability to communicate. So I would encourage everybody, even if you're perfectly healthy, to fill out advanced directives now, and as I mentioned, continue to review those through the years.
It sounds like it would be important to talk about advanced directives in Arizona's Orange form with one's physician. How does a person go about broaching the subject with their doctor?
Yeah, talking to your doctor about all of this is very important. And unfortunately, that often doesn't happen. You know, medical care can be fast and rapid. You see a physician for a particular problem, and you never get to that point where you really talk about your illness and your wishes for care. But it's very important, especially if you're faced with a serious illness, to have time to sit down and talk to your doctor about this. It's important that you, faced with this illness, understand as much as you can about your illness, its expected course, the complications you might face, to really sit with your doctor and talk about your prognosis. That can be hard, and they may not be able to be specific, but it's important to have the conversation to understand as much as you can about your prognosis, and important to talk about your treatment options. Not only the possible benefits of that treatment, but the limitations of the treatment, how likely it is to help, and what are the risks of that treatment, including the potential risk that it could actually cause complications that make matters worse and even perhaps shorten your life. That process in medicine, is sitting down with your doctor, is called obtaining informed consent. As I mentioned, it's hard to get your doctor to sit down and really have that conversation because they're long, often complex conversations with lots and lots of questions. So what I tell my patients is sit down, sit down, call your doctor and make an appointment solely for the purpose of talking to them about your disease, your prognosis, the options for treatment. You want an appointment for informed consent. Don't complain about any physical ailment. Don't tell them your big toe hurts, because unfortunately that often will become the focus of the appointment, and that's not what you want it to be. You want to learn about your illness and the options for care that you have. A couple points are important. First of all, in January of 2018, it became true that physicians get reimbursed for having these kinds of conversations for informed consent, for advanced directives. So you don't have to worry about that the physicians now now are reimbursed for these sorts of appointments. And then it's important to tell the doctor that you'd like this documented into the medical record, and that could you please have a copy of that you'd like to have that as part of your own medical records. And importantly, if you run into doctors that are unwilling to have these kinds of conversations, unfortunately, sometimes it's important to perhaps think about a different doctor, because there's probably nothing more important than your understanding your disease, your prognosis, and your options for treatments and the pros and cons of those treatments.
I realize that talking with your family and your doctor about the end of life can be stressful. So this brings up another topic, and that is about stress. Dr. Moore, how do we prepare ourselves emotionally for this last chapter of life?
So this is the term, the last chapter of life, is really quite appropriate. This is the first and only time any of us will face death. We only get to do this task once in our life. And there's not much preparation for it. I don't remember in school getting taught about how to deal with this. So anytime there's an unknown, there's something that's out of our control, beyond our experience, it causes stress. And so let me speak to that, if I might, how to manage some of that stress. I think the first thing to know is that there's a normal merry-go-round or roller coaster of stress that'll occur. There'll be a sense of anger about the diagnosis. There might be some sadness about the upcoming losses such as not being able to see your granddaughter go to her high school graduation. There'll be moments of incredible wonder and satisfaction, you know, when your great-grandson gives you a hug, when some little friend of yours writes you a card that shares a poem. These will be wonderful moments of connection, and they'll be more vibrant than they would normally be, because we're aware of the vulnerability of life in ways that we never have been before. So expect the normal roller coaster change of emotion. The other piece is that there's some well-researched and appropriate stress management techniques that I think most people know about. Pharmaceutical management, obviously, of pain. I think we'll talk about that a little bit. There's some relaxants in terms of, again, in the pharmaceutical world, just to help you calm down in tough times. And then there's a myriad of other stress relievers. Remembering to breathe. One of the things of, while you're in pain, you basically stop breathing. You're trying to hold yourself so tightly against that pain that you aren't moving air through your body. Breathing, meditation. Most people that I worked with that were successful through this chapter had daily meditation routines where they could go to their happy place, they could clear their minds, they could leave the world of medicine and their diagnosis behind for a short time. Acupressure, massage, going to a nice place in your brain, or literally have somebody take your wheelchair into the woods for a half an hour just to listen to the birds and smell the air. And if you can't physically get there or get out of bed, you can take yourself there in your mind. Transport yourself. Another process that sometimes people use is to do a life review. This gives you a bit of a sense of purpose. My uncle actually wrote his biography in the last months of his life. And he had great fun doing this, telling the old stories and telling what he remembered to be the truth. And it was delightful to watch him do that. We have technology now that you can video record people telling those stories. There are memory books that people can make by assembling all the old photos that nobody ever really knew how to do and put together in a book with memories. Those projects are terrific, and they allow people to kind of review, reminisce, go back and feel warm again about their lives, recognizing that that will soon pass.
Thank you. That sounds like good advice. I wonder if our checklist should also include thinking about pain issues, if that should be a problem during our last chapter. I'm curious, Dr. Fitch, how often does pain play a prominent role in a person's last stage of life? And how should a person be best prepared to manage issues of pain?
Yeah, pain, unfortunately, is common in many diseases. As I think about pain, 3 points come to mind. Again, it's common and it's debilitating. It needs to be controlled. Uncontrolled pain impairs our ability to get better, no matter what disease we're dealing with. So it's very important that your pain is well controlled. And the good news is the vast majority of time, we are able to effectively control pain. A second point is pain is not just physical. Dwight kind of mentioned this, that we talk about the concept of total pain. Things such as anxiety, depression, spiritual distress, they too can contribute to pain, and it's very important that these issues are discussed and addressed. It wasn't uncommon, and isn't uncommon, as I'm caring for somebody who's dealing with pain, and it's pretty clear there's many issues that they're struggling with. And for example, we might sit down and address and talk about their anxiety and decide that it's severe enough that we need to help them with their anxiety. We treat their anxiety in a variety of different ways, and their pain gets much better. So again, that concept of total pain is very important, and to think about all the sorts of things that can contribute to somebody having pain. Again, it's not just physical pain. The third point I want to make is that we don't need to be afraid of opioids and narcotics. I mean, they are abused, certainly, we know that. But they are good medications when used appropriately and for the right reasons. Yes, we need to be cautious, but we don't need to be afraid of them. As Dwight also mentioned, there are many ways to manage pain, and we need to think about those too. Simple medications like Tylenol, ibuprofen. Again, as I mentioned, as Dwight mentioned, treating anxiety, depression, and spiritual distress often needs to be addressed. Things like massage, physical therapy. Dwight mentioned meditation, different behavioral therapies. So that broad range of things that can help us manage pain, they need to also be included. This isn't just take this medication. Again, that concept of total pain and the broad range of ways that we can try to manage somebody's pain. But there is a place for medications, and there is a place for opioids, or what some people call narcotics. Again, these are good medications when used appropriately and used for the right reasons and used in conjunction with all these other ways that we can pursue to help manage somebody's pain. So be sure your pain is addressed comprehensively. And if your doctor is not especially skilled in pain management, it's really a specific skill to really be able to manage complex pain and manage it well. And like many things, doctors don't have all of those skills. And so ask your doctor if your pain's not well controlled and he or she has done the best they can. Ask your doctor for a referral to a pain specialist. And in a setting of being faced with a very serious life-limiting illness, referral to palliative medicine is also a very good idea. Most palliative medicine physicians, the palliative medicine team, are adept at pain management, and it includes palliative medicine teams, it includes social workers, includes chaplains, psychologists, psychiatrists, to again address that concept of total pain. So get a referral if your doctor has done the best they can, but your pain's not well controlled. Your pain needs to be well controlled no matter what kind of illness you're dealing with. You want to get past the pain so you can deal with the other issues of your illness. because pain itself is debilitating. So get your pain well controlled, see specialists if you need to, so you can get on with the rest of your care and the rest of your life.
We've talked about talking to our family and our doctors, but even when they have support in place, people still often have a fear that their wishes might not be honored, especially if an emergency arises and their support people aren't around. What happens if I show up in an ambulance at the emergency room and my family isn't there? Or what if I don't have family that I can trust to carry out my wishes? Dr. Moore?
A tough situation when you're feeling that alone and maybe that alone. The metaphor that I use in this case is to think of assembling a team to help you through this last, I'm going to change the metaphor, the last quarter of the game or the last 10 minutes of the game. I hopefully won't take this metaphor too far, but your medical power of attorney is your coach. This is a person who's rational, can act on your behalf, as Tom said, when you cannot act on your behalf. But they can also help you think, even when you're cognitively stable and you're thinking well and you're still alert, they can help you think through some of the decisions. Do we need to ask for a palliative consult, for example? The medical power of attorney can help you think through that. And all of the other questions, is your pain managed properly? If not, what are we going to do about it? Should we try to get you signed up for hospice? All of those questions that occur in that last chapter need a coach. And so that's a person that can do that. The other members of the team are, if you have them, friends, neighbors. My experience is that when folks who are at the end stages of their life call on people to help, it's amazing how willing people are to help. It's uncomfortable asking for help, but the willingness of others to do so is immense. So I would ask neighbors that I've maybe been just an acquaintance with, any friends. And these team members need to do different things. There are certain team members who can be really assertive about things, like put the schedule together for grocery shopping and cooking and cleaning up. And there's going to be somebody who comes in and does that and does the baking and takes care of the kitchen. There are going to be some of the more emotionally sensitive team members who are really willing to sit with you and hold your hand during the bad pain and talk to you about the last chapter memories. Other folks on the team should be, if you can, whatever family members, be sure they're on board through those last stages. If you choose, for example, to use medical aid in dying in the states that have that law, you're going to need a couple of close people to help with the witness statements, signing those, making sure your second request is made to your doctor, picking up the medications at the pharmacy, so on and so forth. Active members of that team. And my experience is that gives a tremendous amount of relief to the patient because they're no longer alone in this process.
I know there's a lot of resources people can access online. Compassion and Choices has a form or a booklet called 5 Wishes that's accessible online and includes a checklist of sorts. Dr. Fitch, what is your experience using these kinds of resources, and what are the pros and cons of using them?
Yes, I think there are many resources online that are very, very helpful. You mentioned Compassion and Choices. They have an abundance of information. You can get lost in all of their information, but I think that's actually helpful sometimes to dedicate some time and get on their website and review the things they have. And they do have advanced directives, those documents that we talked about. The 5 wishes they also have. So I think it's very, very helpful to get online to review all the things they have and to review the advanced directives. Reading through them can be very, very helpful. You can print them off. there are many, many other sites. Our site, I think, can be helpful. Arizona End of Life Options. There's Doctors with Dignity. In Arizona, and I think true in almost any state, to get on the Attorney General's site, you'll find that you can click on advanced directives. It's titled different things, end of life kinds of things, and you can click on that and get a hold of and look at the different things that the state of Arizona has to help people. Those two can be very, very helpful. So I think there's a whole variety of different sites that are available for people online that are, in general, very helpful.
This has been a great discussion, and I want to thank all three of you for being here today and identifying these important items that we should include on our checklist. To our viewers, thank you again for tuning in, and don't hesitate to call Dr. Moore if you have any questions. Please visit our website if you haven't done so already, and subscribe to our newsletter so you can stay up to date on the progress of our campaign. If you're interested in volunteering with us, just click the volunteer button and Kem will be in touch with you.